speaking with Beth Macy, author of Dopesick and Raising Lazarus. Beth, if you could talk about the impact that Big Pharma has had on the single-payer healthcare movement, which would effectively, pull the teeth on the opioid crisis in many ways, because let's face it, most, if not all, the things that are done to, mitigate the circumstance is about the for-profit industry that is healthcare, as well as the criminal justice system. I think they're all interconnected. I think the whole system is connected because it's all for-profit. We're in very late-stage capitalism right now. But obviously there is this growing movement, if you will, of recognition that, this is not a stigma that people need. They need to recognize that this is an actual health crisis. And the way we deal with it is by basically defanging Big Pharma. Your thoughts on that?
Well, we know that the Medicaid expansion still hasn't passed in 12 states. Many of the states are red states that have some of the highest overdose death rates. And again, you've got politicians running on tough on crime, personal responsibility. And that just seems like another case of low-hanging fruit. We have an 87% treatment gap in the nation. That means only 13% of folks with OUD have managed to get treatment in the last year. So one of the ways that I think we would help a lot is there's an act in the Senate right now called the MAD Act. And it would basically take the waiver away. Right now, physicians have to have a special training, a special waiver to prescribe buprenorphine, when they don't have to have anything special to prescribe opioids or OxyContin, the reason you need buprenorphine. And so I think there's some really, and I know the Drug Czar's office is on board with this. I know they know what the science says. I just think they have to be so careful, and because it's such a political sticky wicket. And, it shouldn't be, because we know that opioid use disorder affects everyone, rich and poor, black and white, red and blue. Absolutely. And, I know the answer is education. It's removing the stigma. And at the beginning of the book, I was so frustrated. I was like, why can't the president just do, why can't Congress make a law and have this be so? But it's, as Dr. Josh Sharpton points out in the book, it is mostly a political problem. It's not that we don't know what to do. It's that we don't have the political will to get it done.
Yeah. And I think that's why this is important. And that's why I like to do this, is because I feel like the more people that are aware, the more people will show up and ask for it and demand it. And there are so many people that have been touched. I don't think there's anyone who doesn't know someone who hasn't had somebody who's OD'd. It's so rampant. It's like, how many million people now?
Over 1 million people have died of drug overdose since OxyContin came out in 1996. And 7 million people are currently addicted.
When I had very serious surgery, I had a microdiscectomy, even though it's, considered not the biggest surgery in the world, but it was on, my lumbar, and it's on the spine. And so a partial piece of the disc was removed. And as a result, I was obviously in a lot of pain, and they prescribed OxyContin for me to deal with it. Now, normally you would think if you're recovering from something of this significance, you would only take OxyContin if you were in excruciating pain and literally are physically incapacitated, can't move, need to be able to, basically calm down the swelling so you can actually physically move. Now, I would say over the course of my recovery, I took 3 OxyContin total. They prescribed 60 OxyContin for me. And as far as I can tell, because I have always been straight-laced, that the whole idea behind giving you that many pills is to get you hooked on them. Mm-hmm. That's the goal. And if I don't get hooked on them, because these are considered a hot commodity on the street, I could have sold 57 OxyContin pills and probably made a couple of $1,000s, just like that.
Oh, more than that. It sold for $1 a milligram.
That's amazing.
Yes. So 180, you could get $80 for.
So the whole system is designed to not only screw you, but to suck you in at the same time. Sorry for the puns, but it's the truth. And OxyContin is just one of many, but it's certainly one that was designed specifically for profit. That's it. And no matter how many people have to die, no matter how many families have to suffer, no matter how much people are in pain, whether it's your friends, colleagues, whoever, there is somebody out there that figures, well, if anybody's going to get rich, it might as well be me. And if people have to suffer as a result, then that's the way it's going to be. And that's why I am a huge advocate for universal health care.
Yeah, no, that's one of our primary purposes. But what places are doing it right? Like what areas have you seen that are, do you think, and even if it's other countries that are really doing a decent job at helping people that are suffering from opioid use?
Well, New York just opened 2 supervised consumption sites, and that's been another big political hot potato. But I'm for anything that gets people back into systems of care. That 40% of folks who don't think they can get better, who don't want to stop using drugs, we're going to help them use more safely so that then when they're ready, we can connect them to care. And we know that happens. There's been 0 deaths in the world at safe consumption sites. So Canada is also a model. Switzerland, you can get heroin-assisted treatment. And like, what? You're giving them heroin? We're giving them a little bit of heroin so they don't have to wake up with the first thing on their mind being, oh my God, I'm in terrible withdrawal. I'm dope sick. Where can I get drugs? We're going to give them this little amount so that they can start to work on their trauma, their family situations, get their jobs back. And you see it working. The science is so clear. Europe was way ahead of us on this, as is Canada. And, a few places in the States. There are, not to say safe consumption isn't happening in several places in the country. It's just happening underground. And then these 2 places in New York, and I think Rhode Island is due to open a pilot site soon. There's also been a big discussion in Philadelphia, but they keep running into legal barriers there.
Yeah, I think that the more that people understand what we do need to do for people and are just aware of what's out there as far as possible treatments, that the more we can advocate for that. And I think that it really just comes down to, we have to care about other people and see that they're suffering and not see them as criminals. And the whole idea that drugs have been criminalized, to me, it's just always been a healthcare issue that we need to address. And for some reason, we've really been susceptible to this punishment, punitive mentality, where we want to punish people for every bad decision they've ever made. And it's really unfortunate. And I'm curious if you noticed that kind of attitude when you were, talking to people out there and doing the research for this, that it's they just really don't give a crap about other people.
Yeah, I mean, we have all grown up in being inculcated in war on drugs thinking, this idea that, it's a crime, these people are moral failures. And then we have X million of jobs of people who are employed by this huge machinery of the drug war, which was designed for racist purposes, during the Nixon years to shore up his Southern strategy. And it's just grown ever since. There was a time before the war on drugs, actually under Nixon, who appointed the nation's first drug czar before the drug war. He was trying to score points. It's all about scoring political points. He was trying to score points with returning veterans from Vietnam who were addicted to heroin. And so he appoints a drug czar, the first one we've ever had, Dr. Jerome Jaffe, this kind of crusty psychiatrist, and gives him a week to basically design a program of walk-in methadone clinics. They end up starting 300 in the nation. And that's the kind of care I'm advocating now. You could go into one, no questions asked, not have to pay, and get help with housing and social supports. But back then we spent 70% of our drug budget on treatment and 30% on incarceration. Since then, of course, in the 80s, it totally flipped the other way. And now we need, more equilibrium or a move back to the way Jaffe designed it.
I know this is probably a dope question, no pun intended. Why exactly, from your perspective, are they able to get away with what they're able to get away with? I know the simple answer is, well, they just buy Congress. But ultimately,
propaganda.
You have these families that, they'll do something terrible that will allow them to profit, $50 billion. And then, oh yeah, we're going to slap you on the wrist for $6 billion. Well, it sounds to me like they're getting a pretty good return on investment. So why do you see that?
So they made $13 billion on OxyContin and they're offering $6 right now. And they have this phalanx of lawyers, consultants. I mean, after the 2007 slap on the wrist, they hired McKinsey consultants who moved into their offices and taught them how to do an end run around these new corporate integrity agreements they promised to abide by. There's a great new book out called When McKinsey Comes to Town that parses that. Their chief legal consultant makes $1,790 an hour, and he's just one of dozens of lawyers and consultants that they've hired. And as Richard Sackler once famously said, he could get any Congress or senator on the phone, in a day or two if he wanted. Money buys power.
Yeah. So somebody was saying somebody who's sitting there and trolling me. But one of the things that they said was, can we talk about something more positive? So I wanted to ask you, like in your travels, in what you were when you were working on this book, what is one of the stories that you found really inspired? Because I mean, obviously it's like how many one step forward, two steps back for a lot of the people working in that. But tell a story, because I know there were some that were very inspiring.
My God, almost everybody in the new book is a hero. They are working at the ragged edge of capacity. Many of them are peers, people in recovery themselves, some of whom relapsed during the pandemic because their work was so stressful. But not all of them. And I'm thinking of Nikki King, who was an addiction pioneer in rural Indiana, who basically the town of Batesville took a vote. What is our most pressing problem? Opioid overdoses by far. And she challenged the court and the criminal justice system to help her and her nonprofit hospital design a better solution. And so what they did is when somebody would come out of prison or jail, they would wrap services around them. They would get them signed up for Medicaid in India. They would get them jobs. And so the programming was all at night after they worked. They would help them they connect them to food pantries, get them on MAT. And in 18 months, they had 0 overdose deaths. I mean, this is something that if you've got the Medicaid expansion, I wrote about it for The Atlantic and then I put it in the book because it's just this is one person who grew up in the epicenter of OxyContin in Eastern Kentucky and just like, by God, she's going to make a difference on this. And she knows how to do it. But, it was a political hot potato there too. And, the day my story came out, the hospital CEO had bought a bunch of copies and he quickly put them in a closet because some of the judges and the probation officers didn't like the way the story came out. They thought it gave her too much credit. And so you've got these small town politics that are so difficult to deal with. And, here's this woman that's designed this amazing program and it's actually working. So I thought it was important to show both sides of that,
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.